access clinic. The focus of the clinic is primarily acute injuries with a focus on fractures. So essentially fractures are time-sensitive injuries. We want to get to those within 2 weeks to either set the fracture or perform surgery. And so we provide a location for those patients to get in, sometimes same day, sometimes within a day or two of their injuries. And the types of injuries that we typically see in the clinic would include fractures of all types, so a fracture in the knee, the ankle, the shoulder, something like that. We also see injuries, things like tendon lacerations, so somebody's cutting an avocado and it cuts their finger and it cuts their tendon. We would see those. Wrist sprains, elbow sprains, sports injuries, so people that get hit in a football game or fall while cheerleading. Again, our primary focus is on fractures, but we do see other injuries as well. And we'll be happy to get you in within usually a couple of days.